Hoag Memorial Hospital, the most respected medical institution in Orange County, has been affiliated with the giant Catholic hospital chain Providence Health since 2016. But you wouldn't know it from Providence's publicity materials. The chain removed Hoag's 3 facilities from its website listing of Southern California locations sometime in late October or early November. But that was just one of several actions Providence, which is based in Renton, Washington, has taken against Hoag. In June, Providence terminated Hoag specialists from St. Joseph Heritage Healthcare, its network of medical providers for managed care plans in Southern California. According to USC healthcare expert Glenn Melnick, who has been consulting with Hoag officials, Providence didn't inform patients of the change until late November, giving them little time to find new specialists before they had to choose their healthcare plans for 2021. In early December, Providence informed Heritage members that they would lose access to Hoag's 13 urgent care centers by the end of the month, even though the urgent care centers have been a first line of defense in fighting the pandemic, Melnick said in a court declaration filed by Hoag. Providence operates 4 non-Hoag urgent care centers in Orange County. These changes all followed the filing of a lawsuit by Hoag in May to dissolve its affiliation with Providence. The lawsuit says that the expanding imposition of Catholic Church restrictions on health care upon Hoag's largely nonsectarian operations and Providence's undermining of local and community decision-making. Some at Hoag connect Providence's actions directly to Hoag's effort to extricate itself from the affiliation. Cutting off access to specialists feels retaliatory, says Robert Lewis, an experienced specialist in pituitary surgery at Hoag, a rare specialty that Lewis had spent 7 years developing at Hoag. The burden, he adds, falls directly on patients. Providence's cutoff, Lewis says, came at a time of year when demand for his services peaks, both because the holiday period affords patients time to recuperate and because many have reached the deductible limits of their health plans and therefore incur lower charges. The rug is being pulled out and the patients are the ones who are stuck, Lewis says. Providence has referred some patients to experienced specialists in the surgery at UCLA Medical Center and Cedars-Sinai Medical Center, but that means patients must travel across town for the delicate procedures and will be far from their doctors if complications arise. Providence's notice to patients that Hoag facilities and physicians would be dropped from its network came at an especially inopportune time, during the late 2020 surge in COVID-19 cases and hospitalizations and toward the end of the open enrollment period for 2021 health plans. It was the most inappropriate, inexplicable and harsh thing to do to a lot of patients, Hoag Chief Executive Robert T.